Ramaswamy Govindan, Professor of Medicine, Washington University School of Medicine in St. Louis. Once again, for us to understand this better, we got to go back and understand how the cancer cells evolve over time. A normal cell becomes cancer cell because the genes inside the cancer cells get messed up or mutated. When these genes get messed up or mutated, they produce abnormal chemicals, we call them proteins, on the cell surface. And the immune system, our immune system is hardwired to identify abnormal proteins on the cell surface. After we are born, in the first few years of our life, our immune system learns our body very well. In other words, it really knows what belongs to us, what belongs to somebody else. That's why if you put somebody else's skin onto your skin, the immune system immediately rejects the foreign skin. And the same way, the foreign organs get rejected because the immune system, our own immune system, knows our body extremely well. So it's always been a mystery for quite some time. How do these cancer cells evade or avoid the immune system? Because the immune system is so hardwired to really find anything that's abnormal in your body. And that's how we fight bacterial infections, viral infections, and that's how we're supposed to kill these emerging cancer cells. It turns out that the immune system does a fantastic job of killing these cancer cells to a great extent. And it is entirely possible that a lot of us are having some few cancer cells here and there, and the immune system cleans them all up. Now and then what happens, these cancer cells find a way to avoid the immune system by doing few things. One is it actually hides these abnormal chemicals that cancer cells produce from the immune system's eyes by not showing them on the cell surface. And there is an elaborate process that is involved in presenting the proteins in the cancer cells to the immune system's attention. And the cancer cells disable the basic processes. And that's one way the cancer cells can avoid the immune system as attention. The other way it can do that is it can produce some chemicals that really makes the immune system look the other way. And basically, once the cancer cells are developing in our body, and they produce all these abnormal chemicals on the cancer cell surface, the immune system comes in to attack the cancer cells, and they come in the cancer cell area, start attacking them, but then the cancer cells produce a set of chemicals that suddenly makes the immune system to step back and just ignore the whole thing. And I'm making this overly simplified, but that's basically the concept. And one of those chemicals, or the system of the chemicals, is this called the PD-1, PD-L1 set of molecules and their receptors. And as many of you know, there are a number of drugs commercially available today that are used in treating a variety of cancers, including lung cancers, melanoma, kidney cancers, etc. And they go after the PD-1, PD-L1, PD-1, PD-L1 set of proteins and the receptors. And the idea is simple, that if you really can go after these proteins that are now produced by the cancer cells to make the immune system look the other way, now suddenly when you take out those bad chemicals, and the immune system can be turbocharged and kill the cancer cells. And that's why we see dramatic responses in about 20-25% of patients with lung cancer who get these kinds of immune therapies. Now, you may ask, what happened to the other 75%? Why are they not responding so well? As you can imagine, nature is very complex, and clearly there are more than one set of molecules to fool the immune system. And we are beginning to understand these things. And one other example is this set of proteins called CTLA4 molecules that are present, that also are involved in the immune system's ability to fight these cancer cells. And the cancer cells can disable that process. And now we have drugs that are targeting the CTLA4 for melanoma, and called ipilimumab, and other drugs that are currently being tested. And ipilimumab has been proven to help patients with malignant melanoma. And the combination of the ipilimumab and the PD-L1, PD-1 inhibitors are also being used in the clinic, both on clinical trials and routine use. And these are just examples, two of several other molecules that are being actively tested that really turbocharge or activate the immune system to go after the cancer cells. So that's only one set of immunotherapy where they take away the bad chemicals. Now, there is entirely different set of immunotherapy approaches that are being tested in a variety of cancers, where basically you can take the immune cells in the tumor, combine in the tumor cells, isolate them, expand them, and then reinfuse them. And this is called the this is called the tumor infiltrating lymphocyte targeted therapy approaches. And there is also other kinds of active immunotherapy called the CAR T therapies. Basically, you engineer the T cells and try to train them to go after the tumor cells. And there are a number of those approaches and that are being tested now in a variety of cancers to really go after the cancer cells. And I think it is fair to say that immune therapies will continue to be a dominant or the major force or major forms of therapy for cancer patients in the coming years. And we have learned one thing over the past 4 or 5 years, that immune therapy in various forms will be quite effective, or will prove to be quite effective in a variety of in various cancers. And I think we're going to exploit that in the coming years through active research.